Our next presenter is Ontario Medical Association. And I think in the original remarks, I forgot to mention at the end, as you're giving your 7-minute presentation, I will let you know when there's 1 minute left. And then I will say when it's over, it will end suddenly. So with that, we'll hear from the Ontario Medical Association.
Great, thank you, and good morning, everyone, and thank you to the committee for the opportunity to address you today. My name is Dr. Adam Kassam, President of the Ontario Medical Association, and I am joined by OMA CEO Mr. Alan Odette and Dr. James Wright, Chief of OMA's Economics Policy and Research Department. Ontario's return this month to modified Step 2 pandemic restrictions reinforces the risk to the well-being of Ontario's patients and economic impact that result from a weakened healthcare system. Each day for almost 2 years, the OMA and our province's 43,000 doctors have seen the deficiencies in our healthcare system magnified under the weight of COVID-19. The impact on patient care is incalculable, and it will take years to catch up. And as the government formulates its 2022 budget, Ontario's doctors urge the prioritization of investments in healthcare to ensure not only our continued well-being, but also because healthcare and the economy are inextricably linked. Ontario can't have a strong and sustained economy without a robust, resilient, and reliable healthcare system that reduces the need for lockdowns and other measures in a public health emergency. We must also future-proof our healthcare system and by extension, our economy, so we don't repeat the same mistakes and make the same sacrifices when the next public health emergency strikes. A strong healthcare system must therefore be the priority. Ontario's doctors took the lead to address these system challenges and in late October released Prescription for Ontario Doctors' 5-point plan for better healthcare, a roadmap of 87 realistic and achievable recommendations to fix the gaps in our healthcare system over the next 4 years. The 8-month consultation for Prescription for Ontario was the largest in the OMA's 140-year history. We listened to over 1,600 physicians representing every specialty and region, associations representing other healthcare professionals, health charities and patient advocacy groups, the health sciences, municipal and business sectors, labor unions, social service agencies, and nonprofit organizations. We also heard from 8,000 Ontarians through our survey at betterhealthcare.ca. The alignment among stakeholders and the public was very clear. To improve the delivery of healthcare in Ontario, it all comes down to 5 key priorities. The first is reducing wait times and the backlog of service. Number 2 is expanding mental health and addiction services in the community. Number 3 is improving and expanding home care and other community-based care. Number 4 is strengthening public health and pandemic preparedness. And 5th is giving every patient a team of healthcare providers and linking them digitally. And look, Ontarians agree. According to an Ipsos survey conducted by the OMA in December 2021, 96% of respondents support the Prescription for Ontario's 5 pillars. And this kind of alignment is rare and tells us that our plan is on the right track. And when asked to identify the issues that were most important to them, 40% of Ontarians surveyed chose COVID-19, unsurprisingly, followed by almost 30% who said either wait times or backlog in healthcare services were important. The pandemic has created a backlog of 20 million delayed healthcare services, more than 1 for every Ontarian. And it will take years to resolve this pandemic backlog on top of pre-existing wait times. Before the recent pause on non-emergent surgeries, it would have taken 30 months to catch up on knee replacements, 25 months for cataract surgeries, 19 months for hip replacements, 14 months for heart bypass surgery, and 11 months for delayed MRIs. There is also a tsunami of mental health and addiction issues brought on or exacerbated by the pandemic. And we have a growing and aging population and a shortage of doctors in certain specialties and regions. For example, Northern Ontario is critically short 325 family doctors and specialists right now. More than 1 million Ontarians don't have access to a family doctor. And this is especially concerning as family doctors provide preventative care and are the gateway to the rest of the healthcare system. On November 4th, the government released its fall economic statement. It was very encouraging that many healthcare commitments contained therein and announced since address key themes and or specific recommendations in Prescription for Ontario. However, before we understand the full scope of investments required, there are many unknowns to be navigated, such as the level of care required for COVID patients, the ultimate size of the pandemic backlog, and the impact of burnout and early retirement among physicians and other healthcare providers. What Ontario's doctors do know is that the current siloed model of care planning was outdated and inefficient even before the pandemic. all key healthcare stakeholders should be convened to get their expertise and perspective so that we can understand the full extent of the problem and how to fix it in the long term. We also know that significant savings are available in the system. For example, in 2019-2020, there were 1.3 million hospital bed days used by alternate level of care patients, costing some $650 million a year. ALC patients are those stable enough not to leave hospital, but there isn't a long-term care, a hospice, or a rehabilitation bed for them to transfer to, or insufficient home care services to return home safely. According to the OHA, it costs approximately $500 per day to provide care for a patient in hospital, $150 in long-term care, and even less for community and home-based care. More importantly, hospitals have less room to treat people who really need to be there. And so the math is clear. Providing care in more appropriate settings would avoid hundreds of millions of dollars a year in healthcare spending. Ontario's doctors also know that the province can't adequately fund healthcare on its own. That's why the OMA strongly supports the call by Premier Ford for the federal government to increase the Canada Health Transfer to 35% of provincial territorial healthcare spending, up from the current 22%. The OMA is also calling for a collaborative partnership with Indigenous Services Canada and Health Canada to address issues of safe drinking water and adequacy of healthcare facilities and resources in Indigenous communities. To conclude, Ontario's doctors urge the government to continue to build on the gains it has made and ensure that investments in our healthcare system, such as described in Prescription for Ontario, are paramount in the 2022 budget. Thank you, and we would be happy to take your questions.
Thank you very much for the presentation.